Hello and welcome to New Mouths Podcast. I'm Sarah, and every week we'll journey together through the intricate world of dentistry. From dispelling myths to exploring the latest in oral health, we've got a packed show for everyone. Ready to dive in? Let's go! Hello, and welcome to another episode of New Mouths Podcast, where we delve deep into the world of dental and oral health. Today we are joined by Jake, an expert on oral healthcare. We'll be exploring a topic that doesn't get as much attention as it should: oral cancer. Hi, Jake. It's great to have you here today. To start us off, could you explain what oral cancer is exactly?
Hi, Sarah. Thanks for having me. Absolutely. Oral cancer is a serious condition that starts with the development of abnormal cells in the mouth. These abnormal cells lead to growths or sores, like ulcers, that don't heal by themselves. It often begins as a painless patch, but can become quite severe if left untreated.
That sounds concerning. How would someone know if what they have could be oral cancer? Are there particular signs they should watch out for?
Great question. Many times oral cancer doesn't present symptoms at first, but general dentists are trained to look out for lesions with certain characteristics like changes in size, shape, and color. If a lesion lasts for more than 2 to 3 weeks, that could be a sign of something more serious. Swollen lymph nodes and systemic symptoms like unexplained weight loss and fatigue could also be indicators.
And when you say lesions, are these always indicative of cancer, or can they sometimes be benign?
That's an important distinction. Not all lesions or patches in the mouth are cancerous. The type of cancer really influences what signs and symptoms might develop. But if you're ever in doubt, it's crucial to get checked by a professional.
I see. Could you give us an overview of the different types of oral and oropharyngeal cancers?
Sure. Generally, there are several types. Oropharyngeal cancers, for instance, can be HPV-associated, often linked to a virus, or non-HPV-associated, which might be related to tobacco and alcohol use. Oral cancers might affect the lips, gums, cheek, or even areas like the salivary glands, and they come in various forms like sarcomas or lymphomas.
And how is oral cancer actually diagnosed?
Typically, a dentist, oral surgeon, or doctor will first do a physical exam to check for any suspicious sores. If they find something, a biopsy may be performed to check if the cells are cancerous. It's a process that might involve various biopsy techniques depending on the growth's location.
What about the staging of oral cancer? How is that determined?
After a diagnosis is confirmed, doctors will establish the cancer stage. They might use imaging like X-rays or CT scans to see if the cancer has spread. It's a scale from I to IV, IV being the most severe where cancer has spread beyond the mouth.
That leads me to the crucial part: treatment. What options are there for someone diagnosed with oral cancer?
Treatment really depends on the stage and location. Surgery is common, and that could be anything from removing the tumor to more complex procedures like a glossectomy or mandibulectomy. There are also non-surgical options like radiation therapy and chemotherapy, which may be used together with surgery, especially in more advanced cases.
It sounds like quite the journey for patients. What can people do to reduce their risk of developing oral cancer?
The most significant step is to avoid tobacco products given their strong link to oral cancer. It's also wise to minimize alcohol consumption, protect yourself from excessive sun exposure, and be aware of viral risks like HPV.
Those are some really practical tips. Before we wrap up, is there anything else you'd like to share with our listeners about this topic?
The most vital thing I'd like to emphasize is early detection. Regular dental checkups play a huge role in catching oral cancer early on when treatment is most effective. Don't ignore persistent sores or patches in your mouth and visit your dentist regularly.
That's a powerful note to end on. Maintain regular checkups and stay vigilant. Thank you so much, Jake, for breaking down oral cancer for us today.
Thank you, Sarah. It's been a pleasure. And remember, folks, a healthy mouth is a critical part of overall well-being.
And that's our show for today. Keep smiling, keep shining, and don't forget to tune in to the next New Mouths podcast episode for more insights into your dental health. Thanks for listening. That's all for today on New Mouths Podcast. I'm Sarah, and it's been a pleasure sharing with you. Always remember, the foundation of a great day starts with a smile. Join us again next week for more enlightening discussions. Until then, keep those smiles radiant.